Hey to all our listeners. This is a Move to Improve podcast. I'm your host, Dr. Matthew Jurgis. We got with me Dr. Alex Fitzowich.
Hey guys.
And our newest guest, Melissa Benoit. She is a physiotherapist with us here at Proactive Health Group, and she specializes in something called Redcord, which we are very interested to talk about today. So can you tell us what is Redcord? Or even tell us a little bit about yourself.
Sounds good. Hi guys. I'm Melissa. I am a physio. I've been practicing since 2005. I started getting into Redcord, I would say 2012. Started my training and then started using it in practice in 2013. Now, if you're not sure what Redcord is, that's quite common. It is more rare here in Canada. It's out of Norway, and it's a specific assessment as well as treatment tool. It's always easier with the visual, so it is a large contraption, and basically it could be multiple pulley points, I guess, if you think of the TRX, except for it's on a moving platform so that we can off body weight or change the axis points for people. So it is a very large machine, and it's not common for physios to do it in Canada, although it is becoming easier to get your training because it's now, I did most of my training in LA, and there's now some training out of Toronto and becoming a little bit easier to access the training. So I got interested in Redcord because I wanted to try and find a way to help patients kind of get to the root of why they're having some chronic problems, and didn't want to kind of always have to be seeing people for the same things. And I kind of came out of my love of Pilates, and I wanted to try and find a way to bring that into my physio practice. I also, which maybe you guys can also attest to, found it really difficult to train people's neck strengthening, and I wanted new ways, better ways for people to become more aware of their neck weaknesses and their postural deficiencies.
Yeah. So there's a lot I want to talk to you about there, which of course is like the process and education involved of getting there, how the machine actually works. But first and foremost, to me, once I got to try Redcord and see what you do, and just being in my practice, I realized there's a huge gap in patient care for people that have these firing pattern imbalances that have basically compensated and have consolidated these patterns within these firing patterns within their bodies, that you can't just tell someone to fix it. Like it's very, you can tell someone to squat, you can tell someone to run, but to tell someone, hey, you need to correct the muscle firing pattern. You need to use your glutes like you've never used them before, your abs or your deep neck muscles. And it can go so in depth, which is crazy. And it really breaks down this like nebulous thing to an exact science, which I didn't think would be, no one thinks that's really possible until you see it. So I think, to me, this has to be something that I believe will grow in popularity and hopefully will become a norm, because I think it'll have an amazing benefit for society. So
Yeah, exactly what you're saying is when patients are actually on the machine, and it can take a while for certain people or certain muscles for the patient to actually feel that activation. So it's a little bit finicky at first, but when they actually can feel that muscle, compliance as well becomes a huge thing. When someone can feel how weak they are. Yeah. It's different than me just saying, okay, your deep neck flexor isn't firing, when they can feel that they can't do that because the proprioceptive input, so how the body's movement, how it feels its movement in space, is so bombarded, so there's a big neural component to it, then I find patients are just more compliant with what they're doing. And there can be quick, if the problem is only that they're not active activating a muscle, you can see really quick results as soon as they start activating it. If it's, something that's been going on for a long time and there's that underlying weakness, that's obviously muscles don't change in their strength in a week or two, but over time that can change. But I'll see, really quick results with people when it's just their brain stopped connecting to that muscle. So that can be really powerful for patients as well. As well as, something I think that this could definitely move into is a preventative kind of place where screening for weaknesses, sports teams, things like that, where we can figure out, okay, you might not have issues right now that you know of, but your patterning is off. So this is, something that could lead into an injury down the road if you're doing a repetitive activity. So if we're finding these things before they become a problem, and we can start creating those training programs to bring in the activation patterns that they're struggling with, then it can have a big benefit, I think, in preventative nature, which is something I think in general is kind of harder for our Western culture to buy into, and something I think would be, definitely more beneficial as we go along.
Yeah, I think it's kind of hard for people to wrap their head around until you try it, what this machine is actually capable of, and when you can see that side-to-side asymmetry, and suddenly you're hooked up to this pulley system, and you're doing these exercises, and there's just no denying, because you can feel something's not firing. You can feel the difference, and then like, okay, it's a thing. And for a lot of people's mind, they think that a firing pattern is just, I just have a weak, it's just weak. But it's not necessarily just weak. It's a neurological thing.
Yeah, exactly.
It's not just, I gotta do more whatever.
Right. And that's, I think, exactly, you highlight an important point, is some of the traditional exercises we are doing totally beneficial, but they might not be solving the problem that we have. If you're doing 1,000 squats and your right glute isn't activating, you can do, you can keep doing that, and that right glute's not necessarily going to activate more. You might get overall muscle, but you're not necessarily fixing that asymmetry. So often what I have to do is bring things down to like the most basic exercises, so that we can make sure that we get that firing pattern. And while you were talking there, I was just going to say, as people are listening, one of the things that I maybe didn't highlight with the Redcord is that I'm actually having people elevated off the bed, either partially or fully. So if you can imagine then that if you don't have kind of the counterweight through your body to push into the bed, that we can see weaknesses. I call it the lie detector test. We can see weaknesses that you can't fight, and you can't compensate as much throughout the chain. So, they're highlighted, and you feel them in a different way. You can feel your body twist, you can feel it rotate, you can feel that, why can't I get that to go? So I don't know if I highlighted that when I was talking about the Redcord being kind of a pulley pivot system, but you are, sometimes I have you almost fully off the bed, but mostly you're at least partially elevated, so that everything is just highlighted more. And that goes into that proprioceptive input of bombarding the neurological system. So the Redcord workstation is, the whole system is called NEURAC, which is neural activation. So that's where it all comes down to is, is your brain connecting to let's talk about your glute, because we were talking about squats. Is your brain fully connecting to that glute? And so that's, part of what makes this different, but also makes it so beneficial, is that it can be kind of a piece of the puzzle that can be missing. Often I'll get referrals if people are, treating the same problems over and over again, and they're getting benefits, but it's not lasting as long, then there's another piece of the puzzle that we can look at to get these lasting results.
Yeah, and I think that's a good point. It's very different when that exercise is open chain. Suddenly you can feel a lot more that's going on in the body, and the issue with just trying to do it as maybe like an athletic therapist or just such a trainer or something like that is comes down to very nitpicky stuff, and especially if that person can immediately feel what you're going for, it's almost an attack on people's ego to just criticize an exercise that they're doing endlessly, because it's not anything that's going to be obvious to the layman person of how to correct that. You're really you're gearing towards a very specific activation, and they could be feeling that they're doing the exercise just fine. Look at me, I can do it, right? But
no, that's exactly it. And how many times have we been with patients cueing and like trying to come up with other cues to get them to activate, and then at some point you're like, okay, it's not harming you. We'll let you move through this pattern, but it's not necessarily benefiting you. And they don't have that connection. So when they really just can't feel that muscle, if we can get them in the right positions in the Redcord to activate, then they start to connect with it. And sometimes I would say it takes people like 2 or 3 sessions, and then they can feel it. Like there's times where people are like, still even in the Redcord, they're like, oh, I don't know if I'm doing it. And then after we do it a few times, then they can actually then carry that over to a gym program, right? Mm-hmm. But that's exactly it. Like, you cue, you see the forms off, and you can't always get them to feel the muscle kind of just on land training, we'll say.
Right. Yeah, I think that's a great point. Like the brain is very much like goal oriented, and it wants to accomplish whatever you want to do. So like the squat is a perfect example. People are like, oh yeah, it's easy, right? Bend my knees, bend my hips, done. And it's like, okay, like there's obviously a lot more to it than that. And especially if they have a compensation pattern, like their glutes aren't firing, they might just be getting that out of the lumbar spine and causing problems there. They might be compensating with their quads, their IT band, their hip flexors, like whatever. And we just need to show them, like break it way down at the start to be like, okay, this one muscle in this one movement is really the reason why you can't do squats. But to try to get somebody to pay attention, like, even teaching someone to squat, what do? Do you say, like, sit back, put your knees out, brace, posterior pelvic tilt, upper back position, chest, head? Like, that's way too much for people. And if they're already not doing it very well, they're just going to keep doing it worse, probably. Right. And so if you can be like, okay, hold your leg like this, then bring it out. You feel how you feel that in your glute med. That's what we're working on. And then it's just writing that code essentially in the brain to be like, this is what we're working on specifically. And then once, like you said, once they feel it, they actually learn that stuff like really fast. Like once you get that biofeedback loop, they're like, I feel it, I can feel the blood in there, I can feel it getting pumped up and stretched and whatever. But until that happens, the brain will like largely ignore any of that stuff. Like, could you imagine if when you were squatting in the gym, your brain was constantly like, okay, what's that glute med doing? Where's that external rotation? Like you couldn't do that. You couldn't get anything done. Yeah. But as soon as you break that down and make it a lot easier for people, then they can start to build back up with the proper movement patterns.
Exactly.
Yeah, it really is quality over quantity, and that's
Yeah.
a hard thing for a lot of people to grasp. And
Yes.
even before I got into this field, that would have been a hard thing too, because we all have our egos.
Yeah.
And we all think we're doing things perfectly. And we all think, well, especially if you do some form of exercise, I'm pretty good.
I can squat 500 pounds. I don't need to do split squats. I don't need to do single leg stuff. It's like, okay, but you can't do a body weight split squat, so obviously there's a deficit there.
Exactly.
For sure. So becoming, qualified to use this piece of equipment is a long process. There's some costs involved. It's complex. It's a lot to take on as a physiotherapist. So you kind of said you saw a gap in people's treatment and you wanted to fulfill that gap, but what was that process like?
Yeah, I would say that's kind of one of, especially the barriers to why there's not more people that do this, is the equipment expense in itself is a lot for people to kind of think about doing, like putting that kind of investment into, or busy clinics don't necessarily see the need to spend that kind of overhead. For me, this was something that I just did personally on my own. I kind of took over that, the cost. It was something I was passionate about. It was something that I really thought was important. And I, spent the money on the equipment. I would go to LA, do my training. And I mean, to me, it's been amazing. The benefits I've seen definitely have been like personally gratifying to see kind of that gap fulfilled for a lot of people. So I do think that's kind of partly why it's not more popular than it is. The accessibility, as well as the overhead. A lot of, our treatments don't take a lot of machinery, a lot of cost, right? It's a lot of our physical self that we're putting in. I had already done my acupuncture, my kind of dry needling training. I have my master's in manual therapy, and I'm on the spinal roster, so I've kind of fulfilled a lot of those things, but I didn't want to become a therapist that was treating people for the same things all the time. I just didn't like that pattern I saw when it's and I wanted to be able to build a more efficient exercise program for people. I mean, I'm a busy mom. I know that I don't necessarily have time to do, an hour program all the time. And when we're talking about rehab, it's not always exciting and fun to do the exercises. So if I can give people even 3 exercises that are going to benefit them the most and that they can do right, I can still see a big change. Yeah. And I think, I see a mix of people. I have the athletes that maybe like that hour program, and that's fine for them to be doing more, and as well as like busy parents who are working, or just busy people in general who don't have that kind of freedom or time, and can do these things at home. There's sometimes equipment involved that often there isn't. So I kind of just like fulfilling that gap with it and making the program efficient for people as well, and not just let's do 50 exercises and see what happens when we can narrow it down to more specific.
Yeah, I think that's an important, point to make. Obviously, there's a lot that goes with providing this service. You're spending a lot of time with these people. You're investing a lot, and you're right. Unlike a lot of care that people receive nowadays is kind of generalized for everyone, you are giving someone an in-person treatment, but also giving them a takeaway that is so personalized and the most bang for your buck rehab. And even exercise enthusiasts will do rehab sometimes, but really they don't want to do the rehab. They want to do the exercise that they love, right? And so I think a lot of physiotherapists or chiropractors or whoever you are, trainers, they get into the thought where like you got to do like these 10, 20 exercises and they're so complex, there's so much to it, when really it can be distilled down to very simple and easy, small number of exercises, and you're getting the most out of your time, which is essentially what patients need. And the easier you make it on them, the more personalized, the more compliance, and the more results you'll get.
Yeah. And I would say the other thing that reason that I love this style of treatment as well is I do take more time with my patients. It's not always I guess the overall cost might be a bit more for patients, but I'm spending a huge chunk of time with them. And even having an hour assessment with someone and actually being able to look at the whole body. Like so many times people will come in and be like, okay, it's my right knee or my right hip. But then they get into a little bit of like a kind of chronic left shoulder, but being able to piece those two together, because the fascial line connection between them can be really powerful. We can't maybe completely ignore the fact that there's a stability problem on your left shoulder when we're fixing your right hip. Like we can actually have the time to bring those pieces together, and I feel like sometimes in our kind of practice models, at least in other practice models I've been involved in as a physio, it was, okay, no, don't have time for that. You'll have to book another assessment for that piece of the puzzle. I really like the fact that I can look at a person as a whole, and that's how the model is that, okay, you're coming in, we have the time to spend on whatever the issues may be as a whole, right? So I think that time is valuable as well in being able to spend that time to look at someone a little bit more holistically than kind of traditional models necessarily allow, I guess, right?
Yeah, and I think that's a big thing in kind of the modern sports medicine is that a lot of people are looking at one area, especially if there's an injury in that area, and a lot of people don't take that like general background view that's like, okay, well, if that right hip is acting up and the left shoulder is acting up, like to me that's two pieces of information, and like whether they're related or not, we don't really know yet, but like probably not a complete coincidence, right? There's probably something going on. And even just getting, you know, with other practitioners here or with the longer treatment times, just being able to address everything is something that people don't see. Like people will go to one guy for their knee, they'll maybe go to someone else for their shoulder. Those guys never talk to each other. Nothing ever gets sorted out. And then just the fact that we have people in-house, we have people like you, Melissa, like that's super, super helpful to be able to just bring that all together, look at everything head to toe and just see what's actually going on.
Yeah.
Yeah, I'm glad you brought that up because I wanted to ask, you know, what has the Redcord system taught you the most about your treatment, and how has that changed your treatment style the most? And I think that's a very obvious one, is how, well, not obvious, but insightful, how connected the body is. And even in my practice, as I push forward, I'm also realizing, and I think a lot of us do, is there's so many connections, and oftentimes that the solution lies further and further from the area of pain, and more than we ever originally can think, I think. More than we, you know, especially the patient, but even the practitioner, more than you initially assume that's contributing, it's totally contributing.
100%. Like, you know, a classic one that we talk about is if someone has knee problems, look at their ankle and look at their hip, because probably why is there more stress on that knee? But even that, it like goes bigger than that, right? What is that hip flexor doing on that side? What's that low core doing? Can they stabilize their lumbar spine? You know, are they having issues when they're doing overhead stuff? Like all the way up the chain, it just really never ends. It's all pieces of evidence that you're bringing together and trying to form a big picture.
Yeah, exactly.
Yeah. And so I know you have a lot of interest towards like fascial lines. Can you speak to that a little bit?
Yeah, I just think, you know, there's more connection to our body than just the origin and insertion of the muscle. So, you know, most people can kind of understand that piece of the puzzle, that your muscles may be a two joint muscle and it might, you know, affect both your hip and your knee. But the fascial lines are going to be even bigger than that. So something on the right connecting to the left shoulder, you know, to the right line.
And for people that don't know what fascia is.
So fascia is like your saran wrap over the muscle. So it doesn't follow the same, it doesn't just go from where the muscle attaches, it's bigger and spreads throughout our whole body. So, you know, the fascial connection I think can be huge. When you contract a muscle, your fascia is also going to be pulled. So if you think about your shirt, and if I were to pull like the bottom left corner of your shirt, it's going to tug your shirt from the, did I say bottom left?
yes. Top right. I got you,
right.
Melissa.
I'm like, wait a minute.
Yeah.
I was like, this is a great analogy.
Okay, what
she
you can't
flopped
see
it.
is me like pulling on someone's shirt right now. But yeah, like you can do that and you'll see how it's going to pull from other places.
Totally.
So we can't completely just look at the muscle in that way. I would say also like my interest now is becoming a lot into nerves, how the nerves affect things. I'm just super big onto that right now. And like, I'm sure that's going to be my next area where I'm just going to like
some neuro stuff.
Really spend a lot of time in some Butler stuff, just thinking about the nerve mobility, thinking about that kind of thing. I've become really fascinated with that. And I think like that's the area. I mean, Redcord is huge about neural activation for sure, and so I definitely have thought a lot about sympathetic, parasympathetic stuff, but I'd love to get more into the bigger picture of the nerve as well.
Yeah, even working alongside you with some patients and having talked to you about neural tension and that sort of facet of care has got me thinking a lot more in my practice, and rightly so. A lot of times it does, especially like we've had some patients with epicondylitis and stuff, and that can seem like a very distal and remote problem, but it's totally a neural tension, a fascial line. It goes deeper than what may be apparent on the surface.
Exactly, and I think that's the biggest thing with being able to collaborate with other people, but also being in a clinic that doesn't just want to treat that smaller symptom, right? It's about, if we could maybe just make that better and call it a day because people are happy that it's better.
Yeah.
But how can we what's the bigger issue? And so I think in our care, there's always that balance between, okay, I want to give people some symptom management so that they're feeling better. And obviously depends if someone's in a lot of acute pain or more chronic pain. But then also, how can we give you some pieces to the puzzle to make this problem less likely to come back? And I mean, you know, ankles are something that people kind of just understand a lot about, and we kind of know, it's common knowledge that if you have an ankle sprain, you're likely to have it again unless you work that proprioceptive balance piece. And I think that goes to every single joint, and I think when it's a less mobile joint, people sometimes don't think about that enough.
Yeah.
But that's kind of the model of everything. Like, okay, we make your elbow feel better, but let's make sure your scap's firing right, because your elbow had more strain on it, and that's either a biomechanical problem with like joint mobility, or it's something going back to its stability point, which is the shoulder blade. And if there's weakness there, you know, and there's some tests I do that just highlight it for people, if there's weakness there, you're gonna have way more strain on your elbow. And if we make your elbow better, but never address that, then we're not gonna help you in the long run.
Yeah, which is a beautiful thing to offer to someone. It's, hey, we want to fix this to the point where you're resilient. Your body's resilient. You're going to perform better athletically. You're not going to get these overuse or chronic injuries. It's a beautiful thing for a patient to kind of get there, and it's a tall order, right? It takes work for sure, but totally worth it. So I guess one of my follow-up questions here is, who can benefit from this style of treatment, and why do we see that commonly in our population? People.
I think anybody can. I do think that it's a patient that is ready to actively do the work will get more out of treatment, this type of treatment, because although there will still always be some passive elements to it, the majority of it is going to be active. Like, even when you're in the Redcord, you are working out. It's like a workout when you're in it. So if you have zero interest in actively working out, then, you know, this wouldn't be for you. It should be. You probably want to be, but that's maybe not the right time for you. But really, anyone can benefit from this. Like I said, there's that preventative element. So I will get people who come in, you know, that I've maybe helped with a specific injury, that come in almost preventatively to test muscle strength, to make sure they're still on the right track with their firing patterns, as well as people who are actively more in, you know, they're having an issue with something specifically, but it is, you know, something that can be used preventatively for someone. Like, okay, you know, right now maybe my back's not sore, but it's something that I have had problems with, and I want to make sure my glute is firing. I want to make sure my low core is activating. So it really can benefit anybody, but I do think you have to come in with the mindset that there's going to be work for you to do, because you won't get the most out of it if you're not ready to put in some of that work, I would say, for sure.
Yeah, and in general, that's kind of like the mindset our clinic has, is that we give you the tools to take care of yourself for the rest of your life, do the sports you want, do the activities you want. And yeah, like having that buy-in really helps. It motivates people, it gives them the confidence, all that kind of stuff. But if they don't want that, then it's not going to be as beneficial. And it's another point that you mentioned, is that it's really more of an ongoing process, rather than either being fixed or being injured, because a lot of people have that mindset. But if you teach them early on, it's like, hey, this is what you do to sustain the health of the muscles and the joints and the movement patterns and everything like that. You know, because it's one of those slippery slope things that you don't feel yourself getting worse, and then you start to feel worse, and then it's like already too late. And so a lot of times just keeping it on that and just having the patients understand that, yes, like, my health is something I should take care of every single day. I should do these exercises, even if I don't have pain, like that kind of thing. And I feel like our patient base really responds to that, and I think that's why we get such good results, because they have the buy-in, we're willing to work on it with them, and then we just kind of maintain everything as long as we can.
Yeah, exactly.
Yeah. So it does take a nuanced understanding that pain is not, like, pain oftentimes the last sign of an injury, and you can go beyond that. I think to a lot of people that makes sense, because they'll do exercise, and every time they do exercise, that pain comes back, or every time they do a certain activity, an issue comes back that they've been dealing with for years. And when you explain to them, yeah, you're compensating, you're not using the right muscles for the job, this is something that can be corrected, and it'll be a long-term, lifelong fix that's going to prevent this from haunting you the rest of your life. But it takes some commitment, and it takes some investment. But if people that are willing to, the payoff is enormous.
Exactly.
Yeah. All right. Well, absolutely thanks for coming on the show. I'm really glad we got to talk about this. I'm super enthusiastic and stoked about the whole Redcord. I hope it catches fire within the practitioner healthcare community, because there's an enormous amount of benefit that can come from this.
Exactly. Thanks for having me. Nice to chat with you guys.
Mm-hmm. All right. Thanks again to all our listeners. Really appreciate all the support. So come check us out we're honestly on Spotify, we're on iTunes, we're on Google, YouTube, everything. So thank you.